Good morning, everyone. At the onset, I would like to thank the organizers for giving me this opportunity to share whatever little experience I have had in evidence-based research, both conducting the research and publishing it. And, incidentally, I've been on both the sides of the table. Uh, 12 or maybe more, 14 years back, I started this journey of evidence-based research. And initially, when I used to send as an author, when I used to send my manuscripts, I used to hold myself with the bated breath and I used to think whatever the reviews, I used to imagine what reviewers are going to send the comments. And definitely, many times I've also got very critical comments. But I've never been disheartened, and I have treated all the comments very positively. And now, being on the other side of the table, I also make sure that I send very specific comments. And definitely, if you kind of take these comments very positively, they improve the quality of your manuscript. And it is not just for evidence-based research, but for any manuscript that you submit. So I'm really thankful to the organizers once again. I am Professor Priyanka Kapoor, and I am currently the professor and in charge of Department of Orthodontics, Faculty of Dentistry, Jamia Millia Islamia. And as I said, that whatever little experience I have gained in the past few years, I'm here to share that. I definitely do not say I know everything about the subject, but it is just a practical and personal experience that I'm going to share. And maybe it is helpful to many of you. What kind of evidence that we generate? Definitely. Okay, let us start with an example as I do in majority of my classes. So the current hot topics in orthodontics, what are these? So if I ask you, they can be either acceleration of tooth movement or aligners. Yes, aligners have definitely come up in a big way. But whether these aligners are as effective or more effective than the conventional braces, uh, we definitely would like to know. And if I have to recommend an aligner therapy in my clinics, what kind of evidence would I look upon? I may be doing in a few 15 to 20 patient study in my own clinic, or I would also be sending this methodology to one of my friends in the other clinics or in the other hospitals. And we may be publishing some case reports or some case series combining all our cases. Or we may also be able to conduct certain kind of non-randomized or randomized trials in our individual practices. But are they sufficient evidence to base our clinical decisions that we recommend to our patients? Are they sufficient? Definitely no, because they are not comprehensive. So we need to compile all the evidence that is available in aligners versus conventional braces, and then we have to present it in the form of good quality evidence-based research. It can be a scoping review, it can be a systematic review, or a meta-analysis, and that is what we need to follow if we have to give a good quality support to our therapy that we are recommending to the patient. So as you can see, the pyramid, when you talk about the quality of evidence, the highest level is systematic review and meta-analysis of randomized controlled trials. So that is what we are going to base our evidence-based practice upon. So if I have to say that my clinical policy decisions, okay, this is a case where I would recommend my aligner therapy, or this is a case where I would recommend the conventional braces therapy, definitely it's based on the evidence synthesis in the form of systematic reviews. And that is the time for EBP, which is evidence-based practice. What is it dependent upon? It is dependent on the highest quality of evidence. It is also dependent upon the clinician's expertise. I'm more comfortable in aligner therapy. My colleague is more comfortable in conventional braces. So that may also be one of the reasons. The other is patient expectations. Sometimes the patients may not agree to the cost factor or the aesthetic component. So maybe, all these decisions combined make the evidence-based practice. But first and foremost, we need to have high quality evidence to base our EBP or the evidence-based practice upon. So how is a systematic review different from compiling all the evidence that is available in the form of normal review? Because the systematic review will have a set of clearly formulated questions based on the PICO format, which is participant, intervention, comparator, and outcome format. So they need to be critically appraised with certain explicit methods to actually present the evidence to you. So if I have to compare conventional braces with aligner therapy, I need to have specific outcomes in my mind. So I can't, combine all the outcomes that is available, be it the clinical outcomes, maybe the tooth movement rate or the tooth movement, how it is happening in the vertical, sagittal, and the transverse parameters, or the patient expectations, or the quality of life. So I can't compile all. I need to have a very clear cut focus in my mind. Okay, this is what I want to compare. And that is where the comparator also is going to come, where the outcome is also going to come. So this is very, very specific. But the other kind of evidence-based research, which is also very commonly published, is critically appraised topic or scoping review or a rapid review. Although there are 14 different typology of reviews, these are majorly which are published, but based on the comprehensiveness of the search, on presentation of the data, on the risk of bias, and also on the methodology, as you can see, even then the systematic review and meta-analysis, they have the highest quality. So definitely that is where we are going to base our evidence upon. But generating evidence is one thing. And, sending it for publication is a completely different domain. So you have to start writing, you have to start compiling, and then you have to start submitting. So this is, again, as I said, it is also based on the years of publishing that we kind of, outlined that there are very specific parameter in any manuscript that we need to take care, which the reviewers always look for, and which are actually responsible for the rejection or selection of the manuscripts. So any manuscript, if you see, whether it is an evidence-based research or it is a normal manuscript, it is based on the IMRAD format, which is introduction, methodology, results, and discussion. So this is basically a basic format that all the scientific manuscripts, they follow. So we kind of, because as I said, years of submitting manuscripts and, going into the nitty-gritties and the details of each aspect, we kind of outline and we published a Kapoor and Chaudhary manuscript quality checklist tool, which is an MQCT tool. It was copyrighted by us in 2021. And as you can see, this is the copyright format. And here we divided this checklist tool. You do not have to apply this checklist tool after you prepare the manuscript. You keep this checklist tool in front of you while you start preparing the manuscript, because that is the first step, keeping the reviewer expectations in your mind, what that reviewer is going to look into for your manuscript. You need to have those set of parameters incorporated into your manuscript so that there are less chances of rejection or disapproval. So this is a quality checklist tool. I'll be discussing that. Although this checklist tool is prepared for the normal manuscripts that we send, but majority of the points are applicable to the evidence-based research also. And I'll be applying each point and showing you the examples based on each point. So just be patient. I will be taking few examples. I'll be taking few of my examples and few of other examples also. So as I said, two main things that are present. We are focused today is evidence-based research. So I've taken two good systematic reviews which have been published. And by good, I not only mean the methodology, as an evidence-based researcher, we also make a name for ourselves in this domain, in evidence-based research. And on the right side, if you see Paparegio, this is an article which talks about treatment outcome with orthodontic aligners and fixed appliances. This is a highly acclaimed evidence-based researcher. So the methodology is mostly, quite critical and quite explicit. So you can actually trust the evidence that is generated by such authors. Even the left side article is a very good article, and in a very good journal it has been published. So if you talk about the effectiveness of minimally invasive orthodontic tooth movement by maybe the micro-osteoperforation, it says that it could accelerate tooth movement, but there is a low quality evidence related to it. And on the right side, when you talk about orthodontic aligners and fixed appliances, it definitely says that the current evidence does not support the clinical use of aligners as a treatment modality, which is equally effective as the compared to the gold standard of braces. So, our myth is broken. We think that the aligners are maybe more effective than the conventional braces, but this systematic review does not support that. And the possible outcomes for any systematic review, the evidence that is generated can be either of the four, either this particular treatment can be effective, or it does not support clear cut, or the evidence appears to support but is not definitive, or there is inadequate evidence. So if you look at the left side, they say that there is a low quality evidence. So evidence three, option 3 or 4 is majority of the dental systematic reviews, they fall in option 3 or 4. When we talk about the process of doing a systematic review, there is a critical step-by-step explicit process, and mostly there are 9 major steps. And again, based on the experience, we have published a copyright manual or a copyright flow chart for it. So if anybody wants to catch hold of any of the copyright articles, you can contact us. And the dissemination, we are more interested right now because we are not talking about the process of how to conduct a systematic review, but how to publish it. So that is the last step of dissemination. What does dissemination in evidence-based practice means? Either you publish it in a well-reputed journals, as I've shown the examples also, or you update. See, if I published a systematic review on level of cytokines in orthodontic tooth movement in 2014, now it is my responsibility, because every 2 years, 4 years, 5 years, if the number of articles that are added to the same interest are many, so you need to update your records very frequently. And also you need to update on the registry records like Prospero, which is a non-profit organization for registering the systematic reviews and meta-analysis. So this is again as a flowchart, as I said. And the dissemination, I've just shown a few examples of mine only. So this is a few of my work which have been published. And as you can see, a lot of citations if you publish in good quality journals and you have conducted the systematic review very well, you are going to be acclaimed academically and in the researcher community by good number of citations. So you can see in both, you have very good number of citations. And this is again few I published in different domains, because evidence-based research is a very beautiful, it is a process. Once you learn the process, you can diversify your areas of interest. So I published in forensics also, I published in biomarkers, and also in microRNAs. So as you can see, these are a few of my publications. But once you prepare a manuscript, before sending it, you need to understand how the manuscript is going to undergo the peer review process. So first of all is choosing the right journal. Definitely we're going to discuss about it. Then you submit it. It goes to the editor. The editor, sometimes if you're very unlucky, you may get a desk projection. Immediately it can come back to you that, okay, it does not fall into the preview of our journal. Or I'll give you an example. Like we had kind of done a study where we wanted to measure the intercanine and the intermolar width amongst different ethnicities and different facial shapes. So we had sent it for publication in one of the orthodontic journal, but we immediately got the response back that you should be sending it to some anthropology or a forensic journal who are more concerned with the ethnicity. So it was a very valid point. So we have to look where we are sending and which journal we are sending. So it goes to the editor-in-chief. Many a times it comes back from there itself. But if the editor decides, okay, this is falling into the purview of the journal, he may send it for the peer review. Peer review may be 2 types. It may be a blinded, single blind or a double blind. Majority of the articles that we get as reviewer are double blind, where the authors and their identifiers, they are masked. So we don't know who the authors are. The authors don't know who the reviewers are. But sometimes we also get the manuscripts which are single blind, where we know who the authors are. But it is not a very transparent process of peer review. At that time also, you can reject it if you feel that the article is not okay to be published, or there are some major flaws which cannot be corrected, or you can suggest some minor and the major revisions. And again, it can be sent and the authors can revise it. It can be rejected or accepted, and then it can go to the copyright and copy editing and proofreading, and then it can be published. So this is a basic process. But when you talk about choosing the right journal, okay. So this is a very small video which is available on my YouTube channel, how to choose or select the right kind of a journal. I'm not going to show the whole video. You can take the link from me, but I would just like to tell you on what parameters should you base the choice of the journal. So when you talk about scope, I've already given you an example of how we look at the scope. You should look at the scope, whether it is fit to be published in that particular journal or not. Hello friends. So this is I'm Dr. Priyanka Kapoor, and today I'll be discussing how to choose the right journal for your manuscript. Let's go online and type Journal Finder. So this is just an example that I have told you. I'm not going to show the whole video to you, but the main criteria that you should look, one is scope of the journal, as we mentioned. The other is how much time they're taking for acceptance. Maybe you have some interview looming up and you need faster acceptance or faster processing. Then you have to look for that publication frequency, and open access is the very important point. You see, the number of citations that I've shown you for any of my evidence-based research it's high because all these are open access journals. If you have a subscription based journal, then definitely many of the readers will be dissociated, or they would not pay to look through your journal. So you should try to look for open access journals, but many times they have high publication charges. So you have to look for your preference, and based on that, you should choose the right journal. And if you talk about the components, then definitely we have talked about the IMRAD format, which is introduction, material methods, the results, and the discussion. But before that comes abstract. So abstract can be either on the left side, as you can see, it can be a structured abstract, or on the right side, progress in orthodontics, you can see it is a non-structured abstract. But even if it's structured or non-structured, it will definitely have all these components. The IMRAD components will already be there in these abstracts also. Although the word limits will be different in different journals, so you have to stick to the word limits. But a very important point that you should know, this is, again, now I'm breaking up the checklist tool, and I will be mentioning the checklist tool for all the points. So in the checklist tool, point number 6 is abstract. So you can see that the introduction for any abstract is 25% of the total abstract. The methodology is approximately, again, 25. Results take up the maximum portion, that is 35%. And the discussion and conclusion are 15%. Because for what you've conducted this research, you've conducted it for giving some kind of results and attaining some kind of evidence so that it can be applied to the healthcare. But for that, you need to completely discuss the results, and that is taking up most of the portion of your abstract. If you talk about the material methodology, it is 25%. Yes, it has to be explicit, but you cannot take up more than 25% in the whole of the abstract. But as I said, that this checklist tool was prepared for the normal manuscripts, but now I'm extrapolating it to the evidence-based research. So there are a few points which I have mentioned just based on my experience that should be there, because if I'm a reviewer, I'll be looking for all these points. So for the introduction, just in one line, you introduce the topic. And then in the objective section, you kind of, preferably you mention your research question, which is very, very important and should be based on the PICO format. For methods, the date when the search was done is very, very important, because you can't just submit an article where the search was done 2 years back. So you have to mention the date of the search. And if it's a systematic review, not a scoping review, then the registration has to be mentioned in Prospero. Number of databases. In abstract, you don't need to mention the detail of the databases, but like you can say, okay, we looked for the articles in 5 databases and also did the hand search and the reference search, and used a free text term or a mesh term. You can use that, but you cannot, look for the whole of the search strategy in the abstract itself. That is for the manuscript. Types of studies, whether non-randomized, randomized, or observational studies, you have to mention. If there were any language restrictions, like you chose not to, non-English articles you will not take. So you have to mention it here. Date limit, like some of the, maybe the aligner therapy was not there 25 years back. So you only limit it to the 25-year search. So you have to mention that. Data collection heads, how it was, in what heads, like the study characteristics, the participant characteristics, the outcome characteristics, in how it was mentioned, you have to mention in methodology in one line. And the quality assessment criteria, like if it's a randomized trials you are just taking, so then you can mention the ROB tool, or if it's a non-randomized or the observational studies, you can mention. If it's a diagnostic study, you can mention the quadas tool. So whatever it is, you have to mention the how the quality assessment was done. If it's a systematic review, for scoping review, you don't need to mention the quality assessment. If you've done a meta-analysis, then you have to mention which effect model you have taken. Either it's a random effect model or a fixed effect model, the sensitivity analysis, and the grade if you've done it. Results, in the results section, which is taking up again 35%, as I said, you have to mention what is the gist. How many, after the whole selection of the articles, how many articles were finally selected? What were the participants' criteria that are important? What were the study criteria which were important? And then you have to combine the outcomes and present it statistically here. If it's a qualitative systematic review, then you don't need to mention the stats, but you have to kind of prepare a gist of all the articles and present it here. But if it's a meta-analysis or a quantitative analysis, then you have to mention the relevant statistic. And you also have to mention in one line what are the limitations. Now, in discussion and conclusion, as I said, discussion is not that important, the abstract, but conclusion, one line, which is very, very important, because that line people are going to use for their healthcare decisions. So you have to have that one line very specific. Like in this example, it says that the current evidence does not support the use of aligners as compared to the conventional braces. So then this conclusion becomes very, very important. After the abstract, we go to the introduction. As I said, I've broken this MQCT tool into different parts, and I'm applying each of the points now on the examples that I've taken. So when you talk about clear aligners, is it followed? Just a minute. I think it is not visible to you. So here, is the format from general to specific followed? Yes. As I say, 1.1 has been followed. General to specific means that you're talking about a broader problem, and then you're narrowing it down to your own location. Like if I talk about aligners, then you're talking about the adult patients and a wide survey, and then you're coming to your population where this aligner therapy is being used. So a broader to a specific relation that you're following here. 1.1. Is the research problem explained? Have you explained that you're talking about the clear aligner therapy, and what are the other therapies that have been used, and how the limitations of those therapies are there, and now you're reaching to your therapy. Are greater than 3 studies mentioned for previous work? Yes, definitely. If you talk about 1.3, you can see in this more than 3 articles have been mentioned which talk about this aligner therapy versus the conventional braces, how it took upon. Is the gap in literature explained well? Well, for all the methodological bias and their ability to withdraw, the evidence, the robust evidence was not present. So this gap has been presented. And so this compilation was decided. Are the aims and objectives mentioned? So in this, definitely the aim has been mentioned, but if I give you a personal recommendation, I would definitely like to tell you that you should mention your specific research question here based on the PICO format, because that was one of the comment on one of the articles that I got from a reviewer, and I have followed that to the T till date. And it really helps because your research question, as I said in the systematic review, is very, very specific, and that explains everything. When you talk about material methods, definitely when you talk about the evidence-based research, the protocol and registration are very, very important. So when you talk about the registration, it is in Prospero, as I said, that is the site where international registry for systematic reviews and meta-analysis. The eligibility criteria, you must have decided, okay, that if I'm going to take a take on clear aligners versus conventional braces, I'm going to look for randomized trials. I'm going to look for non-randomized trials. I'm not going to look at the animal studies, and I'm not going to look where there is no comparison. So I will be only taking up the studies where there is a comparative mode. So, all kind of eligibility criteria you have to prior specify, and you have to stick to it. Then what kind of information sources you have used? So maybe you are using minimum of three databases you have to mention. Preferably don't use Google Scholar, because, if I get a manuscript as a reviewer where they've mentioned Google Scholar, I definitely ask, because Google Scholar is so wide, you get very vague responses, and you get like the results, initial search will give you like in thousands, which you are not able to go through. So it is kind of, for me, I definitely ask for a raw data if they mention Google Scholar. So preferably you should take PubMed, you should take Embase, you should take Scopus or Web of Science, or even DOAJ, some are free. So you can, or you can look for help. Like we have in our university, we have subscription for Scopus, we have subscription for Web of Science. So in any case, you have to go through at least three major databases, and then besides that, hand search or reference search. So you have to mention all that. Study selection, how you've done, and then you come to the PRISMA, that is preferred reporting items for systematic review and meta-analysis. How the data collection process has been done. I will show you all the examples. What is the risk of bias? As I said, you are using an ROB tool, or you're using any other Jonah Briggs tool or Quadas tool. You have to mention that. How you have synthesized the data, whether it is qualitative, it's quantitative, and what is the effect size. And if you're doing a meta-analysis, all the stats, which you will be applying, that you have to mention here, because it is methodology. You right now don't have the results. Here you are formulating the methods. So in the methodologies, I said, again, I've broken the checklist. Is the ethical clearance mentioned? Study design explained, sampling explained, inclusion exclusion criteria explained, procedure explained, whether it is reproducible, is the reference for standard procedure given, or the statistical methods, are they appropriate? So when I talk about the review that was registered, so again, you can extrapolate it to the evidence-based research, because the ethical clearance here would mean Prospero. The study design, yes, the search in detail has been given in annexure. How the search was done, it was done by two reviewers independently, and that the consensus was achieved with the third reviewer, and which databases you have mentioned. So all these, they will explain the study design in the methodology. For an evidence-based research, this is the study design. How you have kind of comprehensively done the search, and how you've applied the inclusion and exclusion criteria, how you have identified that, how you have screened, then how you have put the inclusion exclusion criteria, then you have identified the articles which are to be finally included in the review. So that is, and then if it's a systematic review, then you also have to mention the quality assessment. So this is, again, you can apply this checklist tool even before you send it for publication. So, standard summary characteristics have to be there. So all these are actually applicable to your manuscript before you send it for publication. So in methodology itself, you can mention all these. This is an example of a table which can come even in methodology, because all these criterias, you will say that, okay, these participant criterias I'm going to consider, or I'm going to look into. So you can already formulate this kind of a table. Additional tables, like if it's a biomarker study, then how the biofluid collection was there, and biomarker analysis was done. So I will also be looking into all these criteria. So these additional tables also have to be coming in the methodology section. PRISMA, as I said, this is preferred reporting items for systematic reviews and meta-analysis. So it is divided into identification, screening, eligibility, and inclusion. So this flow chart, you can also mention the details of the inclusion exclusion criteria by adding a box here. But these four criteria have to be mentioned in the figure. Then when you talk about stats for the studies, for the quantitative analysis, you need to understand how to, if you're a reviewer also, then you need to understand how the forest plot works. So for a forest plot, as I said, in a meta-analysis, this is just a figurative representation of the whole results. So the center line is going to represent the line of no effects. The number of blue boxes that you can see are the number of studies that have been included in the meta-analysis. And the diamond is actually going to tell you the summary effect measure, which is the result of all the studies that are available to you. So if you look at my forest plot only, this is our study only. So one of the parameters for the anterior lower facial height between USA patients and control patients. So you can see that we have mentioned each of the studies separately. The mean value of the ANS to Gonin Nachion distance was mentioned. SD value was mentioned. The weight that each study carried was mentioned. The mean difference was mentioned. Although this is not a time to explain the whole forest plot to you, but we should know that there are three basic characteristics that each forest plot has. One is a descriptive analysis that you can see here in column 1, 2, 3, 4, 5, and 6. This is the descriptive analysis. This image is a forest plot image, and heterogeneity is here, that is I square. So, that is actually heterogeneity. If it is more, then you have to do a random effects model or a fixed effects model. So that is actually going to explain the forest plot to you. So you have to know that if you're doing a quantitative or a qualitative analysis, what kind of figures that you are going to include in your manuscript. So if it's a meta-analysis, then definitely your this forest plot image has to be mentioned here. If you talk about the results section, then the study selection, study characteristics, the risk of bias within the studies, the data synthesis, and additional analysis has to be present, or sensitivity analysis. So let us look at the example. So in the results section, as I said, are the key findings presented clearly, or there is a repetition, significant results mentioned, non-significant results mentioned, are the tables and figures easy to comprehend? So please do not explain everything that is present in the tables. As I mentioned, I've already shown you the table. So there you have to compile the data, and each column has to be compiled separately, whether it is a participant characteristics or a study characteristics. You have to compile each of them separately. And one very disturbing thing that I see in the results section is that sometimes your studies may be 4 or 5, which you finally included in your systematic review. You kind of try to explain all these studies separately. The whole idea is to present a cumulative results to the audience, to the person who is reading it. So please try to compile some common parameters, some common points, so that the reader is able to take an informed decision as to whether this therapy is better than the other, or whether this is applicable or not. So you have to compile it, and don't just mention the individual studies. If you talk about discussion, did the results answer the research question? Are the author's interpretations of the results mentioned? Were the strengths mentioned? Were the limitations mentioned? See, one very important and very common thing that I see in discussion also is that if suppose the systematic review is on cytokines and orthodontic tooth movement, so I don't have to start my discussion by explaining orthodontic tooth movement is this and that, and this is the optimum force, and these are the mediators. No, I don't have to explain that. Discussion has to be directly, this is the line that I'm telling you. The current meta-analysis explored the association of biomarkers and multiple body fluids with stages of skeletal maturation. So you see that the start has to be completely in sync with the research question that you had earlier mentioned. So you have to do that. And if you're doing a meta-analysis, not on all the studies, so you have to mention in here itself that although the studies were many, but we did a meta-analysis based on the heterogeneity. We did it on these many studies only. And thereafter, you have to start your discussion based on comparison with the previous studies. And then when you mention the strength, you have to highlight new facts. Like in one of my studies, I had mentioned that one new fact which came into account was that the cytokine levels, it varied with the ovarian cycle. So definitely that's a new point. So you have to mention the strengths also. Even some strengths in methodology, if they are there, you have to mention it here. Then in the limitation section, you have to mention, okay, what caused the heterogeneity, what caused the low level of evidence, or, lack of uniformity of study design. So everything, any kind of limitations have to be mentioned here. And whether the extrapolation of findings, sometimes this we find very disturbing in some of the authors, which when they send that their results or the discussion when they do, they mention certain results which are not actually a part of their manuscript at all. So you have to stick to what you have found out and what can be a potential from there itself. So the threshold level of inflammatory mediators for initiation of OTM, like orthodontic tooth movement. So there the threshold levels were mentioned in few studies, but here we proposed that this can be studied in the future. So based on the results that we found in our systematic review, only then I can propose it further. So you can't just mention what you've not studied. You can also add visual illustrations because they are more explicit and they're more easy to understand. This can also be added, and they add weightage to the acceptance levels also. So these are our own illustrations that we have mentioned. When you talk about conclusions, conclusions has to be very specific. They have to be based on reported data, and you can't just mention any other conclusion. You can do it in paragraph form, or you can do it point wise. You can do it either ways, but it has to be very, very specific, as I before also mentioned. When you talk about references, either it can be Vancouver, AP, or any other style, but you have to follow the whole style of the journal where you are referring to. And one, again, very disturbing thing is that sometimes we use reference management software. We forget to delink it. And sometimes when you look at the reference management softwares also, the references are incomplete. So before you send the manuscript, please look into it that your references are complete, and you have to delink the reference management software before you send the manuscript for publication. And general writing skills, you have to have very simplified and short sentences. You have to use active voice and don't use too many acronyms. Again, I'll tell you an example because the latest systematic review which got published was biomarkers in skeletal maturity. So in that, since it had gone to a journal which was a more general medical journal, where they also used to look at skeletal maturity. So we had sent it there, but there they were confused about the staging because some of the studies mentioned CVS, some mentioned CS, some mentioned CVMI. So they kind of sent us many queries back. Okay, how you can generalize this thing and don't use too many acronyms. So, we have to work out a way where all these, because our authors were different and they were using different staging systems, but we had to work out a way around. If you want to look into it, you can go through the article. So these are the various comments that you can get. But as I said, please take it very, very positively if you get such comments. And this is how you have to kind of send the response to the reviewers back. First of all, please thank the reviewers because it is a thankless job for them. They are doing it free of cost. They are spending their time from their busy schedule and they're reviewing your manuscript. So please thank the reviewers for spending their time, valuable time for reviewing your manuscript. Then you have to, on the left column, you have to have comments. On the right column, you have to have the responses. And when you send the edited manuscript, please highlight in track changes mode or do it in different colors or highlight it in different colors so that the reviewer knows where you have made those changes. And I prefer to do it very, very point wise. And I also mentioned the page numbers and where all I've made the changes, despite doing everything in track changes mode. So this is the kind of table that you should mention. And the take-home the message is that you have to own your manuscript. You have to process it step by step. Please don't miss any process. We have given you a checklist tool. You can keep it in front of you, and then you can start preparing your manuscript so that you minimize the chances of rejection. Choose the right journal, as I said, and don't plagiarize. Please write it on your own. Avoid repetitions. Do not, undergo the same thing in tables. Do not undergo the same thing in text. The references, they really, really annoy the reviewers. So please take care of the references and keep the raw data handy because sometimes they can ask you for the raw data. Means that how you did the initial search, even those Excel sheets have to be maintained. What can't be included in the manuscript, please send us an extras, or you can also write one sentence that they can be available from the author on request. And be transparent, be polite, and take the comments positively. You please start loving the process of scientific publishing. And believe me, it's a lovely process. And even the comments back and forth, the replies that you make, they make you stronger. They make you a strong academician. They make you a strong researcher. So please take them positively. Thank you so much. And I would be happy to help. This is my mail ID and this is my website. So I'll stop sharing now. And thank you once again.